Greetings all. Hope you're well and I hope you are safe. Welcome to week 5. So this week we're going to continue to build upon what took place last week in regards to our case conceptualization and our written case presentations. So those that had not presented their written case presentation on the client that they'll be working with, those individuals will present this week, as well as we will begin the process of presenting our first of 3 counseling recorded session. This week, we're going to continue to advance our awareness, knowledge, understanding, and skill set of our clinical skill demonstration. All right. We will do this by utilizing a number of 3 forms. All right. The first form we're going to use will be the 9 thinking hats, a description of the 9 thinking hats, as well as the counseling reflective form and the form 6.5 and the Jurgensen test are all highlighted in this week's, assignment for recorded sessions. But again, you will present your recorded session, 15-minute segment of that recorded session. Prior to presenting your recorded session, you will identify one of the 9 thinking hats that you will assign to one of your classmates. All right. 1 hat, 1 classmate. You will then present the 15 minutes segment of your counseling session that you've identified. At the conclusion of that segment, your classmates will provide feedback to you based on the hat that you assign them. At the end of the time of everyone providing their feedback, you will then respond to any feedback that your classmates have presented to you. And then finally, I will provide some observational and closing feedback on areas for growth to be used in upcoming sessions with your client and to be demonstrated in your counseling session. And then finally, you will submit your counseling session in the identified area within the module, along with the 2 forms that you use to complete the review and identify your 15-minute segment. Again, these guiding instructions are included in the week 5 recorded session assignment. We will also continue to build upon our understanding of how to best use assessments in counseling, observational assessment, theoretical assessment, as well as assessment instruments in our process of working with clients and appropriately identifying a clinical diagnosis, provisional diagnosis. And then finally, you will complete any and all readings, weekly assignments due for this week. Look forward to seeing everyone on Tuesday. As always, if you have questions, comments, concerns, please reach out. My office hours continue to be Monday and Wednesday, 1 to 3. Come by my office during that time, call me during that time, or join me virtually. For quicker responses, simply email me and I'll get back to you within 48 hours. Do take care.